Launched in July 2023 to tackle the country's 1.7 prevalent rate, the national HIV self-testing pilot implementation was aimed at reaching 100,000 Ghanaians. At the end of the implementation, 140,000 kits were distributed across 50 districts in Ghana. Out of this figure, 123,088 kits were distributed through targeting, out of which 121,373 were used. This resulted in 239 confirmed cases being recorded, with 202 cases successfully linked to health facilities for care. Speaking to the media, President of the Ghana HIV and AIDS Network, Garnet, Ernest Amwabi Otson, revealed that per the data recorded, 72% of women from the 50 districts tested positive for the virus, compared to 28% of men, while petty traders led a chart of those tested positive by occupation out of the 123,088 voluntary tests reported.
We had about 72% of the women testing reactive and going for confirmatory tests. And then also, even if you look at those who have been linked to care, the women still are more than 70%. If you look at the figures for those who tested reactive, the age bracket 20 to 24, 25 to 29, and then 30 to 34. Those were the age groups that were leading. For the reactive, we found out that the highest number were petty traders, followed by farmers and other populations. The major outcome of this project is that we're able to put 202 people who otherwise would not have known their status on treatment.
Reacting to the report, Program Manager, National HIV and STI Control Program, Dr. Stephen A.C. Addo, said a lot more men need to be targeted in subsequent implementations, adding that the findings of the pilot implementation would be used to make a stronger case for sustained funding towards the fight against the disease.
This is a challenge because we've noticed also that in the routine HIV program, if you take even the estimated population, about 69% are female. We know generally that health-seeking behavior of men is lower compared to the females. But the fact that that is happening doesn't mean that they are not there. The men are there. And women may be emotionally, by nature, will accept some of the services, including health service. It is not also surprising that is why their life expectancy is higher than men in Ghana. But we don't just have to watch. We have to do something about it. So I'm encouraging the Ghanaians and all our partners to begin to look at it, because already the program, together with other stakeholders, have identified that men are being left behind. We are looking at the District Assembly Common Fund proportion that goes to HIV. And we have to engage through the Ghana AIDS Commission technical support units to make sure that we prioritize that funding for things like that.
Challenges such as myth, spiritism, and fear of knowing one's HIV status have been captured in the reporting, with strong recommendations for enhanced funding towards the 95-95 target by year 2030. Reporting for Joy News, Carlos Caloni, Accra.